This is just the beginning.
Hello and welcome to an Axios virtual event. I'm Mike Allen, a co-founder of Axios, and welcome to my home in Arlington, Virginia. I'm right across the Key Bridge from Georgetown, and it's 76 degrees in here because I don't know how to fix my thermostat. Today's Axios virtual event is on a topic that hits very close to home to me, and I know for a lot of people in the audience. And I'd like to thank AARP for making this conversation possible. We're going to be talking about nursing homes in this COVID moment, and more broadly, how long-term care for people 65 plus is affected by these changes in our world. And there's no part of the COVID crisis that hits closer to home for a lot of people. Thank all of you who are following online. We'd love for you to tweet along at hashtag Axios Events. And you can follow us on Twitter at Axios Events. I'd like to thank my events team colleagues who pulled this off, and Caitlin Owens, who writes the daily Axios Vitals newsletter, who will be joining our conversation shortly. You can sign up for Caitlin's newsletter, my Axios AM and PM, at signup.axios.com, signup.axios.com. Thanks again to AARP. Let's plunge in. Earlier today, I got to catch up with Senator Bill Cassidy. Here's our conversation. We'd like to thank AARP for making this conversation possible. Our next guest is Senator Bob Cassidy of Pennsylvania, coming to us from one of the country's most fascinating places, Scranton. Senator Cassidy, a lawyer, is on the Finance Committee and on my favorite named Senate committee, Health, Education, Labor, and Pensions. Senator Cassidy, thank you for joining this Axios virtual event.
Mike, good to be with you. Thank you.
So, Senator, we're talking today about nursing homes and how it affects people in this COVID moment. There's almost no subject that hits closer to home for so many of our viewers. And you were sounding the alarm early that this was going to be a problem.
Well, Mike, here's the scale of it, just to give people a sense of the scale. The last number I saw was 37,000 people have died in long-term care settings. When you combine the number of residents who died with the number of workers, that's more than a third of the total death count in the country. So this is a grave, serious problem that demands urgent action. When I proposed, now it's way back in early March, legislation to focus new resources on infection control and other practices that would help in the long-term care context, including home and community-based services, because that's where a lot of folks should be provided the long-term care that they receive in a home setting, in a community-based setting where they can be provided long-term care but not have to be in a nursing home. But of course, that at that time, that would include new resources for Medicaid. And because of that, there's a lot of Republican resistance. But I want to continue to press this because I have new legislation now that focuses on resources to deal with the problem right now. And because when you consider what these individuals have given to our country, nursing homes are full of people who fought in wars and worked in our factories and raised our children and built the greatest middle class, built the greatest country in the world. The least that we could do is make sure that we don't have a replication of what has happened over the last several months, where tens of thousands of people are dying in nursing homes without an action plan, which has to start at the federal level. The administration and Congress doing more to combat this problem.
That's a very resonant point you make about how many life stories are in those buildings. I visited a long-term care facility in Oregon, and you can pick anyone, sit and talk to them, and they have a great story to tell you. Senator, in addition to that emergency funding, you also have been pushing for more federal oversight.
We have, and way back in early April, Senator Ron Wyden and I sent a letter to both CMS, Center on Medicare and Medicaid Services, as well as CDC, saying, why don't you provide the information on the number of on deaths and the data on outbreaks in a facility, and provide that information so that not only the resident of that nursing home knows what's happening in the building they live in, but also that their family knows and the community knows. Because there's no way, as we've unfortunately learned in a very brutal way, if you don't test and you don't have a sense of the scale and scope of the problem, you're not going to be able to deal with any kind of COVID-19 challenge. We are still waiting for that data. And the administration has said over and over again, CMS especially has said, we're going to provide this information by the end of May, and here we are. This information is central for our ability to combat the problem, to provide better care in nursing homes, and to stop or reduce greatly the number of deaths.
And Senator Casey, something else that I know that you're very concerned about is what it's like to be living in one of these facilities and the sense of isolation, sometimes not even having the technology that you and I take for granted.
Yeah, there's new data over the last number of years just on the physical impact of isolation. And I know probably a lot of people listening to this are familiar with that. So isolation can have a physiological adverse impact on someone. When someone is in a nursing home and they are accustomed to having a family member come and see them on a regular basis, at least two things happen. Number one is that resident feels that they're connected to someone. That it breaks apart that isolation, or at least reduces it. And the second thing that happens is that the family member, or members plural, become the eyes and ears for that person. If the care isn't good, or if there's something the resident has a question about, or the family member does, they can ask those questions. But now we're in a circumstance where there's total separation, social distancing, and family members aren't able to connect with their loved ones. Senator Klobuchar and I and Senator Capito have legislation called the Access Act, which would provide the technology and the help that families need to be able to connect, at least virtually, because we can't assume that every family of every resident in a nursing home has that kind of technology. So it's a good bill, it's bipartisan, and I hope we can get it done. I do think in addition to that, though, we need an action plan. And the action plan should start with what is in my second bill, Senate Bill number 3768. And that bill would work on prevention strategies so that we're providing more dollars for cohorting. We know that works when you separate in a long-term care facility someone with COVID-19, a resident, with a resident who does not have it. We also need those dollars for testing, personal protective equipment, and even surge teams. You can send in medical professionals that a long-term care facility might need. More doctors, more nurses, more certified nurses assistants, and the like. We have to combat this problem with a sense of urgency. There's no excuse for allowing those numbers to continue to grow. We need an action plan.
Senator Casey, penultimate question. This is from a viewer. Asked if you see more federal regulation regarding infection control.
Well, I'll say this. The administration has focused more attention on infection control now. There's a debate about what happened prior to COVID-19, and I'm not real happy about the way they approached it up to now. But they're focusing on infection control. But what we cannot have happen is, because of scarce resources, the resources go only to infection control. There's still a lot that happens in a nursing home that requires oversight and regulation and vigilance, really. So I think we have to do everything. We have to focus intensively on infection control now. We also have to do other oversight. But in the case where you're trying to mitigate or reduce the likelihood of a COVID-19 spread, we need those surge teams. We need the new dollars for cohorting, because sometimes in a facility, they may want to separate people, but they physically can't expand or retrofit the facility to do that. We need to give them the help that they need. I'm proposing $20 billion in this bill.
Senator Casey, as we say goodbye, I can't let you go without asking you one question about your fellow Scranton native, Joe Biden. Pennsylvania is probably the key to Senator Biden becoming, Vice President Biden becoming president. Biden, what is the outlook for Pennsylvania? Vice President Biden will win Pennsylvania if what?
I think he'll win Pennsylvania, and I believe he will. I think he'll win it if he can combine that coalition that's been successful lately, making sure that urban and suburban turnout is very high, because in both instances, he'll get an overwhelming vote there. What we cannot do, though, is allow ourselves to take our eye off the ball with regard to those small towns and rural areas. Doesn't mean you're going to win them, but you've got to get a certain number in those communities, and that's where 2016 didn't work out very well. And I'm still frustrated by that. I want to make sure it doesn't happen again. The good news is, I think we had a pretty good template in 2018 when I was running and Governor Wolf was running. We were able to get higher numbers in those communities in addition to suburban and urban votes. But I think Joe Biden's very strong in the state for lots of reasons, not simply because he's a native son of Scranton and has good roots in the state overall. But I think his decency, his experience, his compassion is coming through, especially in the midst of this pandemic. And that's what a lot of folks are looking for, especially families that have a loved one in a nursing home or in another circumstance which puts them at risk.
Senator Casey, we always end our Axios virtual events with one fun thing. These are sobering times, so we like to end on a light note. And I get to congratulate you. You are a grandfather, but you haven't. You told me you haven't yet seen your grandchild, right?
I've got a grandson in San Francisco. That's a long way from Scranton. No, the good news is my wife was able to go out weeks before the baby was born and be there, but I couldn't get out there, so I'm looking forward. Thank goodness for video technology as well as thousands of pictures.
Senator Casey, thank you so much for the conversation today, and I look forward to being able to see you in person on the Hill.
Same here, Mike. Thank you, and thank you, AARP.
And now we're going to go across the Parkway to Axios CEO Jim Vandehei.
Thank you, Mike, and thank you to AARP for making this very important conversations about nursing homes on the front lines possible. It's now my pleasure to have a conversation with Nancy Lemon, who is the Chief Advocacy Officer for AARP. Nancy, how are you?
I am fine. Thank you, Jim.
When we think about the coronavirus, it's obviously a national crisis. But when you think about nursing homes and long-term care, it's an authentic catastrophe. You have 1/3 of the people who've died have died in long-term care facilities or working at them. Is it going to get worse? Like, how you spend so much time thinking about this and ways to prevent it?
Well, you're absolutely right. What's happening in nursing homes today and other long-term care facilities is a national disgrace. On February 29th, Washington State reported the first COVID-19 outbreak in a long-term care facility. And here we are 3 months later, and we still don't have a solid, consistent action plan across the country. As of Monday, more than 36,000 nursing home residents and staff had died from COVID-19. That's 1/3 of all deaths. And in some states like Virginia, New Jersey, and Iowa, 50 to 70% of the COVID deaths have been in nursing homes. Nobody should be going through what nursing home residents and their families are going through today. And we're hearing from thousands of our members about their heartbreak. We just heard the other day from Sally Avino from Georgia, who told us about her mother-in-law, Ava, who died in a hospital 30 hours after she was transferred from the nursing home. The nursing home never told her that her mother-in-law was that sick or had COVID. It's just devastating what families are going through.
It's essentially a national emergency. What more could the federal government, state government, what more could we be doing to help these facilities? Because as this spreads, it's soon going to spread to rural communities that might not even have as good of facilities as some of the facilities that have been hit in big cities. What should we do? What can we do?
Well, absolutely, it's going to spread, and it already has. We need a comprehensive plan to protect residents in nursing homes, no matter where they live. AARP has called on nursing homes, the Congress, and the administration to take action. First, in terms of nursing homes, we know that they need to be doing far more testing of everyone and providing personal protective equipment for anyone who works in a nursing home. We heard last week from people who went to see their loved ones and saw some of the people that work there wearing garbage bags because they didn't have other kinds of protective equipment. So that's job one, testing and making sure people have the right protective equipment. Second, we know that nursing homes need to report every single day to health authorities how many cases they have and what they're doing to manage those. And communications not just to health officials, but also to family members. And then finally, we've been working very hard to ensure that nursing homes provide opportunities for virtual visitations of family members with their loved ones. We understand that they're trying to limit the number of people going into the nursing home, but you don't want to cut people off from their loved ones. And then finally, we know it's important to make nursing home residents and their families continue to have their rights. There have been a little bit of a debate about whether immunity should be granted from liability for nursing homes. We think they need to remain being responsible for the health and safety of their residents.
What percentage of nursing homes, long term care facilities, do you think have an inadequate amount of testing materials or protective gear?
We don't have a number right now, but we know that many nursing homes do not have adequate protective equipment and are not fully able to test. And it varies across the country. For example, the state of West Virginia was very quick to determine that they needed to do testing in every facility. At the same time, we know they don't have enough protective equipment for everybody who works in the facilities. Other states like Arizona are very far behind. Maricopa County, which accounts for roughly half of the state's population, is also accounting for about 83% of the deaths in nursing homes. So we know it varies, and we don't have a good number right now. We are working with CMS and the Department of Health and Human Resources to make sure that the nursing homes are able to get the funds they need so they can have the equipment, they can do the testing, and they can meet some of the standards we all expect.
What's probably most sad and scariest about what you're talking about and sort of the reality of these nursing homes, if you think on a spectrum of if and when we all do return to normal, at the very end of that spectrum are people living in these facilities that will be able to have normal interactions with family members again, be able to have visitors, not have to fear sort of reoccurrence of the virus. What can the government do? What can we do to help those people who are a lot of them lonely to begin with, who might go months without human contact from family and friends?
Well, first off, we have to ensure that there are opportunities through the virtual visitations and technology for families to connect with their loved ones. In cases where people don't have families, members, there are a number of efforts across the country, including one that AARP is sponsoring called Community Connections, where volunteers are able to talk to people either on the phone or through FaceTime. This is an opportunity to have real connection. And as you point out, connection is going to be so important. Loneliness is almost as serious a health issue as the virus itself.
So if I wanted to, or a viewer wanted to volunteer with AARP to have one of these conversations by phone or Zoom, we would just go to the AARP website and we could easily find out how we can help.
Yes, you can go to aarp.org/nursing homes, and on that page we'll have the connection so that you can volunteer in that way.
Awesome. Nancy, thank you for a very important and fascinating discussion. And thank you for the work that you're doing, trying to help get relief for a lot of these people who are stuck in nursing homes and are really at the biggest threat to this virus. So thank you very much for the conversation.
Well, thank you. And thank you to Axios for pulling together such a distinguished panel so that we can shine a light on what Congress is considering doing to address this issue as well.
Thank you very much. And back to you, Mike Allen.
Thank you very much, Jim. And thank you, Nancy. I first met Nancy when I was a brand new reporter on the Hill. Pro tip, if you're new on the beat, Nancy's a good person to know. Our next guest is Senator Dr. Bill Cassidy of Louisiana. He's a gastroenterologist. In Baton Rouge, he founded a free clinic to help people who are uninsured get dental healthcare services. My mother, when I was growing up, volunteered in a dental clinic. I know how important that is. Senator Cassidy also worked to get vaccinations for people in Baton Rouge who needed them. Senator Dr. Cassidy, welcome to Axios.
Thank you, Mike. Thanks for having me.
Really appreciate your joining us. And we just heard your colleague on the Finance Committee and on the Health Committee, Senator Bob Casey of Pennsylvania, talk about really this emergency the nursing homes are facing, the need for more emergencies. And Senator Cassidy, this turns out to be an issue that bridges Democrats and Republicans.
Yeah, it does. For example, you mentioned what can we do about, and common theme is what do we do about the death rate among those who are in nursing homes? There's two issues here. There are those who are high risk of infection, and then there's those who are at high risk if they get infected. The nursing homes, folks in nursing homes are of the latter group, high risk if they get infected. CDC has put out recommendations, or HHS has, that we should be testing workers in nursing homes once weekly for virus. I actually think that should be twice weekly. Why twice weekly? Because if you are infected, on average, 5 to 6 days later, you will begin to have symptoms, but you're shedding virus the 2 days before you become symptomatic.
So
that means if you're only you're only testing once a week, you may be shedding virus before you're checked again next time. So if you have a Monday, Friday, you actually should catch most people before they begin to actively shed virus, or a Monday, Thursday, I should say, Tuesday, Friday. So I do think we need to think through viral dynamics, think of populations like nursing homes, and do our best to keep infection out of the nursing home so that we can decrease death rate to the benefit of the nursing homes, but also to the benefit of society.
My colleague at Axios, Bob Herman, who covers healthcare business, did an article the other day talking about how care for seniors is even more complicated in the COVID era. There was always a lot to figure out, always a lot of logistics, financial issues for family. It's even harder now when you can't necessarily get an in-person tour. And as if you look at the stress on these institutions, Senator Cassidy, what's going to be like when this pandemic recedes, Lord willing, like when we're past the immediate emergency, what's the long-term changes or help that you think that nursing homes and other long-term facilities need?
Well, you have to tell me some specifications. Do we have an effective vaccine? If we have an effective vaccine, then you're going to be able to vaccinate folks and kind of things go back to normal. If we do not have an effective vaccine, then you're going to have to make much greater use of telemedicine, telehealth in general. Now, some things don't give themselves to telehealth. So what do you do about physical therapy, occupational therapy, dentistry? You can't really do those by telehealth, and you can't have the person in your right. So you're going to have to figure out what to do otherwise. I think we're going to come to the point where we know that if someone has been previously exposed and clears the virus, develops antibody, that they are immune to future infection. If that's the case, you may have your physical therapist, occupational therapist, be those who are known to be antibody positive, and so therefore they can enter, and you do not have to fear them infecting those who work there. That would be one thing. Dentistry. It may be that you're going to have dental units in which you have all this strict kind of infection control so that the person who lives in a nursing home or who's otherwise at risk can go to the dentist and know that they won't be infected. That's going to be a lot of kind of how do we prove it sort of thing. We'll work it out. We'll work it out. Dentists are great at this. Dentists are incredibly detail oriented. So we'll work it out, but it is something that we have to think through.
Now, Senator Cassidy, something that you've been on the forefront of is pushing the idea of immunity registries. And you had an opinion piece in the Wall Street Journal where you said the young will reopen America. Tell us about your big idea.
Yeah, so it should be more properly, an immunity registry would work. The people who are paying the highest price relative to their risk of complication from COVID-19 are the young. If a 5-year-old is not attending school, she's only 5 once in her life. Her mind is a sponge. She hears a word, a foreign language word, in context. She knows the definition without that definition being written down for her. Oh my gosh, wouldn't it be wonderful to have that brain forever? If we don't allow her in school at that critical mind is a sponge age, she loses and we lose because she's lost that educational opportunity, particularly for those who come from environments which are not as enriched. They don't have internet at home. They don't have the same books. The parents have to work to support the family. So my thought is that if you let the younger people, younger being less than 30, kind of go about their life a little bit more openly, understanding that they, if infected, can still infect other people. You have to take that into account. They don't have the opportunity cost of missing college, missing work, and they can also lead the way in opening up the economy for the rest of us. We have to think that through. The penalties for shutting down the economy disproportionately fall upon the young. We should not penalize them more than we have to. On the other hand, as we give them more freedom, they can benefit us by being our caregivers, working in the service industry, everything else we need to have a functioning economy.
Senator Cassidy, President Trump appointed you to his task force on reopening the economy. Congratulations, I guess you could say. What is the most important thing we need to do to reopen the economy that we're not?
We have to balance safety with reopening the economy, which is to say that we need a strategy which allows the economy, a testing and implementation strategy to allow the economy to again flourish. I put it differently. If I can go safely to a tailgate before an LSU football game without wearing a mask, we've accomplished our purpose. There's a lot of economic activity that comes when LSU wins a football game, or any other school as well. Point being, we are nowhere close to that. And so we have to have that sort of testing and use of testing strategy to allow a full reopening. That's what we need.
Quick question on the personal side. You're also married to a doctor, Dr. Laura Cassidy. What's it like, a pair of doctors in this once a century, once a lifetime global emergency?
Yeah, it's wonderful. My wife actually now devotes herself to head a public charter school. And so this whole idea of reopening school is up close and personal. And we're working very closely together on a testing and mitigation strategy that allows young people to come back. My wife is so bright. She's so active intellectually. Her involvement in that school informs the public policy for which I advocate. It's an incredible blessing to be married to her.
Great. And Senator Cassidy, we always end our newsletters and we end our Axios virtual events with one smile to go. These are tough topics that we're slogging through together. So we like to end on a high note. And you mentioned tailgates. You mentioned LSU. You're both an undergraduate and a medical graduate of LSU. You are the real deal as a fan. You are actually there. What is game day going to be like for the Tigers this fall?
Well, it depends on testing. I'd like to think that it is going to be something which is totally free. We mentioned my wife. She's an Alabama fan.
So are we. I've got a cousin at Alabama, so yeah.
I think I remember that you're an Alabama fan, which I tried not to hold against you. But on the other hand, I'm hoping that it is a measure of recovery that we can enjoy college football and other diversions and not be distracted by people fearing infection. If we are able to do that, then I will enjoy LSU's victory and a hopefully second national championship in a row, but I'll enjoy it even more knowing that we're all safe in doing so.
And so it sounds like you think that there will be some fans in the stands for home games at LSU this fall.
I sure hope so. It is a measure of success of our society if we're able to achieve that. It is not pie in the sky. If you look at South Korea and New Zealand, they have effectively eliminated the threat from public gatherings from COVID. And that should be our goal too. We should not stop less than that. That should be the accomplishment we aim for.
Well, Senator Cassidy, thank you very much for joining Axios. Go Tigers, except when you're playing the Tide.
Back at you.
Okay. Thank you, Senator Cassidy, for the great work that you do. We appreciate it. We thank AARP for making this conversation possible. And I'm joined now by my colleague, Caitlin Owens, who covers healthcare 24/7, including a lot of time on the Hill. She writes our morning newsletter, Axios Vitals. And while we're doing SEC football, she's a North Carolina graduate, a heel. Caitlin Owens, thank you for joining us.
Thanks for having me.
So, Caitlin, as we think about nursing homes, and you've been covering a lot about what's inside the minds of these long-term care facilities, and something that you've done a lot of reporting on is what they're doing to prepare for the next wave.
Yeah, Mike, this is the hard thing is we've learned, yesterday we officially hit 100,000 coronavirus deaths in the United States. As we've talked about throughout this event, a large portion of them were seniors in long-term care facilities. As much of a travesty as that is, we've learned a lot over the past couple of months. It's very obvious that nursing homes are a hotbed for the virus. And it's also becoming obvious what we can do to stop this from happening again. A lot of it comes down to the public health 101 of testing, tracing, isolation. So we need to A, make sure that we're testing prolifically in nursing homes, and B, once the virus makes its way into a nursing home or any kind of long-term care facility, there's stringent isolation measures where that person is kept away from all the other residents of the nursing home, and where staff isn't kind of double dipping, so to speak, among healthy and ill residents. That is much easier said than done, it's turning out. Nursing homes and long-term care facilities often don't have a lot of resources. They're understaffed. They're crowded. And so I think that we're kind of running against challenges that are not insurmountable. We just have to make up our mind to surmount them.
Caitlin, yesterday you and I were texting about this topic, and you pointed out a headline to me. There was an AP story based on their state-by-state analysis that found that most nursing homes in most states are not meeting White House guidelines. What's the significance of that? Why does that matter?
So the White House guidelines were about testing. I think it was that they wanted every resident of a nursing home tested. I think it was a 2-week span. And I mean, that's a big lift. It goes back to resources. It goes back to staffing. Tests are not necessarily cheap. And so I think that why it matters is we need to test, and we need, there needs to be that one-time test to get a baseline of where we're at going forward as states are reopening. But we also need to be doing this all the time. We need to be testing routinely at nursing homes. And the fact that we can't get just kind of, the AP reported that some states not only weren't meeting this goal, weren't even trying at all. I think California was still trying to put in place a plan when AP reported this earlier this week. I mean, we are already behind the ball. We're talking about these things we need to do to try to keep this travesty from happening again going forward. I mean, if we can't do the 101 of testing in nursing homes at least every couple of weeks, I mean, a test is a snapshot of time. You can't just do a test once and say, okay, we're good to go. We're going to have to keep doing this. So clearly, this is a problem that we still need to work on, and we're not out of the woods by any means yet.
Well, Caitlin Owens, thank you for your great coverage. Thank you for this conversation.
Thank you so much, Mike.
We'd like to thank AARP for making this focus on nursing homes on the front line, such a consequential subject, possible. Thank all of you for taking the time to join us in this conversation, for sending in your questions. I'd like to thank my Axios event colleagues who pull these off. 1 million moving pieces, depending on the tech on people's homes. It's amazing what they do. Thanks to them. I appreciate your interest in this topic, and I'll see you on Axios.com.